Here we go. Thanks, Rob, for joining us today. And thank you to everyone in obviously the UK and the US that are joining us as well for this webinar, which is really exciting. Okay, so what we're going to do today is we're going to ask Rob a couple of questions around the common questions asked around ITP. And we're going to start with dental. So what do you need by count to visit the dentist, whether it's for a general clean checkup or, fairly decent, major dental work? Is there a guide?
Look, there is, but it's very rough. I mean, I guess the thing is with ITP, there'll be a person who has a platelet count of 20, has a bruise or mark on them. Then there'll be other people with the same platelet count who'll bleed. So while we can give platelet counts as a general guide, it does very much depend on your, personal history. So generally speaking, to go to a dentist and get a clean and scale, in other words, just sort of general checkup, it's recommended that you have a platelet count of greater than 20. For simple dental extractions, and by simple, that would really be the incisors, teeth, platelet count of greater than 30 is recommended. And for more complex extractions, so that would be the back teeth or the molars, really a platelet count of greater than 50 is required. But look, my oldest son's a dentist, and I've sort of spoken to him about these things. And, there's dental extractions and there's dental extractions. Some teeth come out really easily, 5 minutes, it's all over. Other times, it's sort of an hour of relentless struggle in the chair for both the dentist and the patient. So there is a bit of variability. But I think the important thing is let your dentist know you've got ITP. Don't turn up and just assume everything will go well. Certainly, I find not infrequently dentists will contact me if they've got patients with ITP just to get some reassurance. And the other thing I'll just comment on is people do get gum bleeding. People without low platelets get gum bleeding, and really the most common cause of gum bleeding is not a low platelet count. It's really gum disease, and gum disease really needs a proper sort of dental scaling. And so it's normal to get gum bleeding when you get dental scaling, whether your platelet count's 20 or 250. But if you are regularly bleeding following brushing your teeth, it may well be that you've got gum disease, really, rather than just reflecting low platelet count. So paradoxically, that is a reason to go to the dentist and get everything cleaned out, and which obviously at the time may make things worse, but then is likely to settle things down. And just one other thing he said is, obviously, I think you don't want to be using a hard toothbrush, and there is apparently a skill to brushing your teeth. I'm not sure I have it, but that can be sort of largely offset by using an electric toothbrush, because then really the brush does all the work rather than your elbow doing the work. So if you haven't got a good dental toothbrushing technique, using an electric toothbrush, and you can get them for as cheaply as $20 these days, is a fairly good way of letting the brush do the work without causing as much trauma to your teeth as sort of a standard manual toothbrush would.
That's wonderful. Is there anything that you can recommend, obviously, other than going to the dentist and checking for dental gingivitis or something like that? Is there a mouthwash to help with bleeding gums if it is ITP related? Because I know personally, when my counts are low, I've got bleeding gums, but generally when my counts are fairly good, they're not necessarily.
Yeah, look, you can use tranexamic acid. It's not so good as a mouthwash, because then the drug is only just in contact with your gums very transiently. If you are bleeding from similarly, if you have dental work or tooth extractions, then tranexamic mouthwash soaked in gauze pads and just applied to the area of bleeding can help. But again, I wouldn't just assume it's low platelets. If you are regularly bleeding from your gums, it's likely you have some gum disease. So I'd get it checked out and just don't assume it's low platelets, because it might be something that can be readily fixed by a trip to the dentist.
Wonderful.
So in other words, you want to treat the underlying condition really, if you can, rather than just the symptom.
Not the symptom itself.
Yeah.
Okay, moving to travel, which is something that I think we're all missing and have been missing for the last 18 months, definitely.
Yeah.
When it comes to flying, now obviously in Australia it's a very big country, but and a lot of our a lot of the people in the UK and the US are now able to travel quite a lot. But what are your recommendations when it comes to having ITP and safely flying?
I've no idea where this comes from. I think this is a bit of an urban myth, this issue that there's potentially a problem with flying. Now, obviously, if you're in a plane and it goes down, whether you've got ITP or not, you're in big trouble. And if there's an emergency decompression, which is where, like a window blows out, you can get a massive decompression. That's like diving and coming up quickly. You can get what's called barotrauma, which is sudden decompression. But really, just routine flying, it doesn't really present a substantial bleeding risk. So I think rather than the process of flying, which really is not intrinsically dangerous, is, if you're someone with really unstable ITP, it's really where you're going to, and the fact that on the way there, whether it be in a plane or some other mode of transport, you might be in a situation where if things are really dicey, you're not in a position to get help if you need it. But obviously, I would hope that most people with really unstable ITP or any other disease wouldn't be taking the risk of flying. But if you've got reasonably stable ITP, there's really no particular platelet count that which you should be striving to achieve before you can fly. It's a safe sort of process. Obviously, with long haul flying, there has been, there's a risk of prolonged immobility. If you don't take enough fluids, you might get dehydrated. And ITP, as I'm sure most people know, does confer a mildly increased risk of blood clots, despite the low platelet count. So if you are on a long haul flight, I think the important things for people with ITP, as well as people with no health issues, is to get up and walk around as much as you can, keep your fluid intake up. And I do not refer to alcohol, I refer to water or similar. Really, keep a good fluid intake up, keep moving. Most of the flight magazines will have some little exercises suggested that, keeps the circulation going. But, do those things, common sense things for anyone who's traveling long haul, really. But in terms of ITP and flying, I wish I knew where this came from, because, there really isn't an increased risk of bleeding unless something, catastrophic happens on the flight and, everyone on the flight's in trouble. That, in that case, not just those with ITP.
Yeah, no, it does come up quite a lot, actually, in the when patients are sort of talking amongst themselves, or if someone's about to go travelling, things like travel insurance, which is generally readily available for ITP patients now. Even travelling, to not to lower socioeconomic locations like Thailand and that sort of stuff as well. It's still available. It is available, which is great.
Yeah, look, the other thing, I guess, is if you do have to take medication with you, it's probably as well to take a letter just from your treating doctor, just certifying that the medication's needed. And possibly if you're going to a country where, English is not commonly spoken, it might be worth getting some kind of translation. But yeah, aside from that, I would certainly encourage my patients with ITP who want to travel, just to discuss it, to see whether, it's a safe journey to take. We have quite a network of ITP specialists around the world, and certainly when people have travelled before to various points in the world, people who've potentially would need treatment while they're away, we can often tee something up. So yeah, just talk to your treating specialists. If you've got problematic ITP, because we can often facilitate treatment overseas rather than having to go through an emergency sort of process.
Yeah, well, that's great. Okay, moving on to food. This is generally a fairly big topic. Loads of people, swear by diet changes, cutting out gluten, having things like papaya leaf extract. Have you experienced anything that's sort of outside of the ordinary, particular minerals, vitamins, supplements, that sort of stuff that can help?
Look, I guess the thing is, for the most part, unless you have a specific deficiency of a vitamin, taking more of a vitamin that you're not deficient in really isn't going to make a substantial difference. And in some cases, you can run into trouble with, like, for example, nicotinic acid, which is now being sort of promoted as a cure to, as a drug which can sort of assist in eternal life. If you take too much of that, it can actually cause thrombocytopenia. So really, there's not a lot of role for vitamins unless you're vitamin deficient in boosting platelet function or boosting platelet counts. Similarly, there's a whole load of sort of mythology around things that interfere with platelet function. So certainly there are some there are some, dietary supplements, or there are some herbs, for example, that if you take them in large quantities will have a minor impact on platelet aggregation, that is the platelet's ability to stop bleeding if you cut yourself. But for the most part, really, so for example, onions, blueberries, garlic, if
Turmeric as
you,
well, I've heard. Like
yeah,
during
turmeric
that
too.
period that there was that turmeric coffee, everyone was, oh no, you can't have it. It's like, well,
Yeah, look,
I've got to have a truckload, right? So for it to actually impact.
well, you would, that's absolutely right. Look, if you somehow can invent a process to sort of distill whatever it is, so most of these things like onions, ginger, they have a specific chemical in them, which if you could purify it and concentrate it and take it at, um, a level which would be far higher than you would get just by eating these things in normal quantities. They may have an anti-platelet effect, but you'd have to eat sacks full of onions, or as I say, have some kind of bizarre distillation process going to extract that chemical and concentrate it and take it for it really to make a difference day to day. So look, if you want a bit of garlic or onion in your stew, go ahead. It's really not going to make a difference apart from make it possibly taste a bit nicer.
I know, I'm Hungarian. We can't stay away from onion and garlic and that sort of stuff. So
yeah,
no,
that's right.
I don't think I could survive with that without those ones.
Yeah, look, there are specific drugs, that have anti-platelet effects. Obviously, aspirin, clopidogrel. There are many drugs like the non-steroidal anti-inflammatory drugs, which if you take them long term, will have an anti-platelet effect. So you really need to be avoiding those sorts of things long term anyway. But most dietary supplements have a very modest effect on platelet function, and as I said, unless you're going overboard with them, it's highly unlikely to make any significant difference. So I certainly don't think common foods that you can buy at the supermarket and eat in normal quantities, I don't think we really need to be avoiding any of those.
And obviously, talking to your clinician and depending on what treatments you're on as well will impact that as well, I suppose. So
yeah, there are certain drugs, there are certain things where, grapefruit or Seville oranges, for example, contain a substance that can interfere with the metabolism of certain drugs. None of those are commonly used in ITP, but, there are certain drugs where, fruit has an enzyme, has a chemical in it that interferes with their metabolism. But you will generally be informed about those things when you start taking them. And obviously, if you're a person who takes L-trombopag for ITP, there's a whole load of things that can interfere with the absorption of L-trombopag or Revelade. Divalent cations, which are things like iron, zinc, copper. People can start taking supplements, for example, because they think they'll help, and they can actually do the opposite to what you'd like. They can stop the absorption of L-trombopag. So again, if you're thinking of starting a supplement for your general health or for your ITP, really just check with your specialist first, because you may inadvertently be taking something that could, adversely impact, not through a direct effect, if you like, but by a sort of indirect effect of really limiting the absorption of the treatment that's supposed to be helping you.
Okay, so moving to exercise. With exercise, obviously, in adults with ITP, do you recommend, patients not engaging or, participating in certain types of exercise? Obviously, the benefits of exercise from a mental health perspective are quite good, but do you have any recommendations there at all?
Yeah, really, you want to be avoiding contact or impact sports. So things like rugby, gridiron, or boxing, or sports like horse riding, where if you do have a fall, you could get quite significant injuries or trauma. But certainly things like walking, jogging, swimming, those sort of aerobic exercises, rowing. Absolutely, I would encourage people to exercise using those sports. It's really those high impact sports, sports where you're essentially trying to injure people. Gridiron, rugby, boxing.
Yeah.
Don't put yourself in harm's way by engaging in those sports. Do something, aerobic type exercises: running, walking, swimming, rowing, plenty of options, just
Yeah,
not
yoga, all of those sorts of
impactful.
things as well. Because obviously the benefits of those exercises can help help alleviate some of the side effects when it comes to things like steroid use and, you know, those sorts of things as well, and the anxiety felt by patients just in general with ITP.
Look, I think there's evidence across the board in a whole number of chronic illnesses beside ITP, but showing that if your general level of fitness is good, you regularly exercise, you just feel a lot better than if you're not exercising. So I would certainly encourage people to exercise, you know, stopping short of those contact sports.
Wonderful, wonderful. Okay, in general, we all there have obviously in the I Wish survey we found that fatigue was experienced by quite a lot of patients and a big proportion of patients. Is there anything that that patients that you think that that they can do to help alleviate that fatigue, or is it just a sort of sit, relax, listen to your body type messaging? Or
yeah, look, it is tricky, but you know, the fatigue seems to be a common symptom in ITP. It's, you know, some people I look after absolutely can predict their platelet count by how they feel and get very fatigued with a low platelet count and feel better when it's higher. However, that's not a consistent feeling, and some, you know, there is something about the disease process maybe that makes people fatigued, because there are other people that, you know, you can treat a low platelet count, improve it, and fatigue doesn't always improve. So there's not always a clear correlation between platelet count and degree of fatigue. Treatment with steroids or with romiplostim or atombopag may not necessarily improve fatigue. So it's a tricky one. Look, I would say, you know, fatigue is a very difficult thing to deal with when you've got it, but I would say, you know, if you can, try not to give in to the fatigue, you know, try and keep up a level of exercise and, you know, activity, because I think one of the risks of fatigue is you do less, you don't feel any better, you do even less, and then, you know, you get to a really low level of fitness and deconditioning, and then it's really hard to get going again. So irrespective of the fatigue, if you've really become very sedentary and try to get going again, it becomes even harder. So I'm not saying really push through your fatigue to ridiculous levels, because that can make things worse, but just try to keep going with those daily activities, and if you can, a bit of gentle exercise, because you know, if you give in to these symptoms completely, sometimes it can be very hard to, you know, pull yourself out of that hole and get going again. And yeah, look, it's hard to say. Look, obviously, in some people, you might be worried about, you know, you shouldn't exclude other things like, you know, depression could be a contributor. So that's something that might be worth discussing. Now, your haematologist is not necessarily going to be the expert in depression or management of depression, but certainly it's something that, you know, if you bring that up with your haematologist, it might be worth seeing a psychologist or even a psychiatrist if, you know, if depression could be a, you know, a factor.
That's good to know. I know personally that when my husband actually does a platelet donation, he normally does a double or a triple donation, and he comes home absolutely wiped out. And it's sort of like, well, yeah, that's how we feel when with ITPs. Okay, yeah, goes and watches Netflix and sort of has a sort of not a day off, but he just takes it easy a little bit comparatively. So, but yeah, it was quite interesting to see that he had that experience as well when it came to donations. Talking about blood donations, obviously ITP patients here in Australia aren't able to give a blood donation. But one thing that I thought was actually quite interesting was that you know, women, especially that have had children, can't actually donate blood either. Sorry, donate platelets. Sorry, not blood, but platelet donation.
Yeah. Look, that's to do with a very rare condition called TRALI, transfusion-related acute lung injury, which is a condition where plasma can contain antibodies that can cause that syndrome. And it's, you know, so really women can donate plasma, but that plasma is then sent for fractionation into different plasma components. It's not used as what's called clinical FFP, or it's not used for, if you like, resuscitation of people with major bleeding episodes. It's sent off for fractionation to make, you know, things like blood clotting factor concentrates or fibrinogen concentrates, things like that. So certainly you can, as a female with children, donate plasma, but it will be sent down a different channel to male plasma.
Mm.
In Australia, anyway. I don't know.
Yeah.
I don't know the arrangements in other countries. I imagine it's likely to be similar though.
Similar. Okay. One of the big questions and big comments that I suppose that are asked amongst the Australian patients especially is that, okay, so I'm now experiencing, I don't feel myself, I'm experiencing, you know, an increase in symptoms. Should I wait and see? Should I go and seek medical advice? You know, and they're actually asking other ITP patients. What's your recommendation there?
So you're saying if someone with ITP develops some new symptom. Look, I guess the thing is, if you've had ITP for a long time, you're probably very familiar with the symptoms, which suggests that your ITP might be getting worse. But if you're relatively new to the game, you may not recognise those symptoms as indicating worsening of ITP. I would say, get a blood test, see if you can, get along to see your doctor. It's better to be safe than sorry, and pick these things up early rather than just let things progress and get worse. So if you get any new symptoms, you've got a chronic disease, really get them checked out. If they're if you're already familiar with them, certainly if you've got symptoms suggesting your platelet count might be very low, again, just get in touch with your treating specialist, and hopefully things can be headed off before they get worse.
Yeah, better to be safe than sorry, I think.
Yes,
definitely. Okay, one final question. It's ITP Awareness Week this week. Have you planned to do anything for Awareness Week this week?
Well, as you know, it coincides with my birthday most years. So I have a dual celebration, and my son's birthday, which is very close to mine, who I briefly referred to earlier. So yes, we generally have a week of celebration. My wardrobe isn't replete with purple attire, but I'm sure I can find something to
wonderful,
put on.
Wonderful. Well, hopefully you can post a photo or two sporting some purple or your pin or something like that over the course of the next couple of days. That'll be great.
I'll do my best.
Don't forget to tag us.
Okay, thanks, Danielle.
Thanks so much for joining us today.
All the best.
Thank you.